S9313 was an adjuvant chemotherapy trial that was classified as a negative trial. It compared a sequential versus a concurrent chemotherapy regimen. But we have been able to utilize this cohort, particularly the triple negative breast cancer cohort within S9313, to do a number of innovative biomarker studies. And so we had previously shown that the presence of homologous recombination deficiency or a BRCA mutation was prognostic. The infiltration of tumor lymphocytes was prognostic. Molecular subtype was prognostic. And then a newer molecular signature based on gene expression called the DNA damage, DDIR signature, DNA damage immune response signature, was also prognostic. But none of these had been sort of looked at together, and whether we could use combinatorial classification, particularly related to DDIR and HRD, to stratify breast cancer and identify optimal therapy for patients. So using our previous insight, we developed a dual classification scheme based on DDIR and HRD status, and found that patients whose tumors were positive for both of these markers had extremely favorable outcomes, and their tumors appeared to be enriched in anti-tumor immune features. Patients who had one or the other of these also appeared to have relatively good outcomes. And in the DDIR positive group, we again saw an immune enriched subtype. In the DDIR negative but HRD positive group, we found that there was not an immune enriched subtype. These appeared to be what we call immunologically cold, but they still had a good outcome. And we speculate that that's because they have homologous recombination deficiency and are hypersensitive to DNA damaging chemotherapy. But really the most, I think, important thing we found is that the patients whose tumors are negative for both of these markers have a significantly worse outcome than all other patients. And we speculate that's because they do not have effective anti-tumor immunity, and these cancers are not particularly sensitive to existing chemotherapy or systemic therapy agents. And so we need to find better avenues to address the underlying biology in those triple negative breast cancers.